Over the last 24 hours, we have identified 1,854 new cases of COVID-19 in Alberta and completed more than 19,600 new tests. Our provincial positivity rate sits currently at about 9.5%, and we now have 17,743 active cases. There are 511 people currently in hospital, including 97 who have been admitted into the ICU. These numbers are very concerning, and I know that AHS is watching them closely. Sadly, there have been 14 deaths related to COVID-19 reported to us in the last 24 hours. Sharing the number of lives lost is a little more difficult each day because I know the pain and sadness their deaths cause for the family and friends who are left behind. They are not just a statistic of COVID-19. They represent Albertans who were loved and who meant the world to those who loved them. My deepest condolences go out to everyone mourning the loss of someone special from any cause, especially as we get closer to the holidays. In schools, there are currently active alerts or outbreaks in 407 schools, or about 17% of all schools in Alberta. Currently, these schools have a combined total of 1,561 active cases. This number includes 220 schools with outbreaks, including 100 currently on the watch list. Since new measures were introduced last week, we've received many questions. One of the themes is about carpooling. To clarify, the guidance about carpooling remains the same. Whenever possible, individuals should limit group travel to members of the same household. If that is not possible, we recommend that the number of people in a vehicle be limited to allow for 2-meter distancing between each other. Passengers should wear masks and wash or sanitize their hands before entering and after leaving the vehicle. As well, we encourage having disinfecting wipes available for each passenger to wipe down their side of the vehicle. More detailed guidance on carpooling, along with taxis, limousines, and ride shares, is available at alberta.ca/COVID-19. With the enhanced restrictions, I know there is a lot of information to take in. I would like to thank the many Albertans who are following restrictions to the best of their ability and who are asking these types of questions when they are unsure. This is a great example of Albertans doing everything in their power to protect one another. Knowledge and information from accurate sources is an important part about this. I want to end today by talking specifically to Albertans who don't live in Edmonton, Calgary, or surrounding areas. We are seeing rising COVID-19 transmission across the province. While infection rates in Edmonton and Calgary make up the majority of cases in the province, we are seeing increased spread in many rural communities. COVID-19 is not a Calgary problem or an Edmonton problem. This is a provincial problem within the context of a global problem. When you look at the 15 local geographic areas with the highest active case rates in Alberta, a third of them are outside of Calgary and Edmonton. We are also seeing growing outbreaks in the central, north, and south zones. I know that many rural areas did not see widespread transmission in the spring or summer, and so it's natural that some people living in those areas may feel safe from COVID due to their smaller populations or distance from large urban centres. They may wonder why they should wear a mask or not host a party in their home. Unfortunately, our overall active case rates prove that COVID-19 doesn't care where you live or what your postal code is. It only takes one case entering a community to cause significant spread. That is why it is important that we all follow the key public health measures wherever we live. If people in a community aren't consistently observing physical distancing, wearing masks when appropriate, or staying home when they feel unwell, it doesn't take long to infect a large percentage of the population. Coping with this virus is a challenge for everyone, but being further away from healthcare, especially from advanced services like ICUs, can also make the experience even more daunting for those living in rural areas. That's why it's important that all Albertans, rural and urban, take COVID-19 seriously and do everything possible to limit the spread. The first set of measures last week, as you'll recall, became effective as of Tuesday, and the second set were effective as of Friday, so that full combined impact of both of those sets of measures we wouldn't be starting to see yet at this point. As I mentioned earlier, it does take usually about 5 to 8 days between when someone's exposed and when they start to have symptoms. And then, again, based on our current turnaround times, it can be 2 to 3 days between when someone goes for testing and when they get their test results back. So the bulk of these numbers that we're seeing today would be from transmission events that would have happened prior to those restrictions. However, very soon, over the next several days, I would anticipate we would start to see the early impacts. Of course, we won't see the full impacts of restrictions until another week or so have passed. But we are, as always, watching very closely. As I said earlier, I am very concerned about these numbers. And the actions that all of us take today will determine the outcomes of our numbers in the next 2 to 3 weeks. And so, again, no one should be watching these numbers to determine whether or not they need to change their behavior. Behavior needs to change, and that's already a mandate. And what we need to do as we're watching these numbers is determine whether or not there should be further changes.